Thank you for being here. I wanted to give you a quick update on some of our statistics in the pandemic and also some other news that may be a little bit different than what you've heard from me before. We are, as I've mentioned before, a little behind some of our other southern states where we are with this Delta surge. And this is indeed a Delta surge. Virtually 100% of all our cases are Delta variant. And we're now approaching among the worst cases and both in case numbers and hospitalizations that we've had since January, in some cases actually worse in some parts of the state than we were in January. Saturday, we had 12,223 total cases reported, which was one of our highest daily case rates ever reported. And all 159 of our counties are in a high transmission level, so that in all these areas are considered in the red zone. We're seeing a significant number of cases among school-aged children, and those number of cases have really quadrupled over the last several weeks, with the sharpest increase, the highest number of cases in children aged 11 to 17. Now, the hospitalization numbers, while higher, are still not to the point where they are in other adult hospitalizations. But what's happening, I think, is children are getting infected and are transmitting this, or it's being transmitted to others and among the family members. So children can transmit the virus, and they are becoming infected. And fortunately, not as many are becoming hospitalized. We've seen, however, the highest number of weekly outbreaks since the pandemic began, 170 outbreaks statewide, with more than half of these outbreaks in K through 12 schools. So the schools are a site where there is COVID transmission going on, and we're working hard with the superintendents to try to address these issues in the schools. Our proportion of percent positive PCR is about a little over 17%. That is high, but it's stabilized over the last several weeks. I did want to say that our deaths and hospitalizations continue to be largely among unvaccinated individuals. And I can't say that enough. This vaccination, all three of them work very, very well to prevent against this Delta variant. And yes, people who are vaccinated can become infected. Yes, some have died. In fact, 168 vaccinated individuals have been reported to have died, but that represents only 0.004%, so less than 0.0001% of those who have died have been vaccinated. And I think I can't say that enough. Vaccination is our tool to get us out of this pandemic, and it's so very important. And so I want to tell some good news now, too. We are continuing our efforts to vaccinate individuals throughout Georgia. We have sites at extra capacity throughout the state. And so it's not just here in Atlanta where we've had a number of significant large vaccine events, but throughout the state, and from Valdosta to Dalton, we have the capacity to vaccinate more and more people. We just aren't getting people coming to be vaccinated. I want to just do a shout out of some special events we had this past weekend, because they really were very special events at the aquarium, which was a partnership with Home Depot and our health department in Fulton. In DeKalb County, you may have heard that we actually were able to vaccinate 2,500 individuals in a single event. I really want to give a shout out to CEO Michael Thurman, to Commissioner Larry Johnson, and to Sandra Valenciano, our health director there, who worked hard to make that event so successful and planned several more of those events coming up. And I think that the main thing is that we have the capacity. We want to continue to vaccinate, and we can throughout the state. We just have to have people want to come and to convince them of the safety, efficacy, and importance of it, even as we work to make monoclonal antibodies available. The last thing I wanted to say, and you heard the governor talk about the healthcare heroes. All of us have talked about how the hospital workers have worked tirelessly to keep people alive as they're again and again having patients come, having them on ventilators, having them be critically ill. And I know how tired they are. I just want to say public health has worked in a quiet way behind the scenes throughout this pandemic to vaccinate, earlier to test, and now we are testing and vaccinating throughout the state. And I've become aware that many of our line workers who are doing these vaccinations are receiving threats, are receiving hostile emails, or harassing emails. That's something that has, happened to me early on. Maybe it comes to the territory of someone at my position, but it shouldn't be happening to those nurses who are working in the field to try to keep this state safe. And when I heard that one mobile event in one town had to close down because of the harassment, bullying, and threats that were directed at our team, I just said, this is wrong. This is absolutely wrong. These people are giving their lives to help others and to help us in the state. We in Georgia can do better. We should be thanking these individuals for trying to get life-saving vaccines to our state. And I'm just sorry to let you know about this, because I wasn't fully aware of what was happening at some of our vaccination sites until just this weekend. Thank you.